What are non-modifiable risk factors for cancer? Non-modifiable risk factors for cancer are those that you cannot change or control. These inherent factors can increase your likelihood of developing cancer but are not influenced by lifestyle choices or environmental changes. When we look at testicular cancer, cervical cancer, and reproductive cancers in general, several key non-modifiable risk factors stand out. First, age plays a significant role. The risk of developing most cancers, including reproductive cancers, tends to increase as you get older. This is largely due to the accumulation of genetic mutations over time. Next, genetics and family history are crucial. If you have inherited genetic mutations or a family history of certain cancers, your risk may be significantly higher. For instance, mutations in genes like BRCA1 and BRCA2 can elevate the risk of ovarian and breast cancers, which are types of reproductive cancers. Similarly, a family history can also influence your risk for testicular cancer. Another important factor is sex and gender. Biological sex is a fundamental non-modifiable risk factor. Testicular cancer only affects males, while cervical cancer occurs in females. Hormonal differences associated with sex can also influence cancer risk. Race and ethnicity are additional factors to consider. Different racial and ethnic groups may have varying predispositions to specific cancers due to their genetic backgrounds. For example, some populations may experience higher rates of cervical cancer or testicular cancer. Reproductive history is another non-modifiable risk contributor. Factors such as early onset of menstruation, late menopause, or not having children can increase the risk, especially for cervical and other reproductive cancers. Lastly, previous medical history matters. If you have undergone certain medical treatments, such as radiation therapy to the pelvic area, your risk may increase. This is considered non-modifiable once the exposure has occurred. These non-modifiable factors often interact with lifestyle and environmental factors, collectively influencing cancer risk. While you cannot change these inherent risks, being aware of them can help you engage in more vigilant screening and early detection strategies. This is especially important for managing cancers like testicular and cervical cancer. Understanding these inherent risks allows individuals and healthcare providers to tailor prevention and monitoring approaches. It emphasizes the importance of regular screenings and timely medical consultations for those who may be at higher risk due to these non-modifiable factors. Always consult with healthcare professionals for personalized advice and recommendations based on your unique situation.